Ever since the COVID pandemic began, the healthcare sector in the country has been stretched thin after having been dealt blow after blow. 1 year on since the country reached its peak in dealing with the multifaceted crisis, where the economic downfall heavily impacted every aspect of daily life, we still haven't made any progress on the medical front as the health sector is still in shambles, still grappling with what came consequential to the storm of bankruptcy, inflation, and higher pay as you earn, which prompted a significant number of health workers to seek greener pastures. The call for more healthcare sector professionals to step in hasn't been dire. By the end of the first 5 months of this year, an estimated 1,000 medical specialists of the country's 3,700 had already left the country, rendering some state facilities incapacitated. This also means that certain medical students waiting to be trained under certain specialists will lose out on what could have been a life-changing experience. Not just that, after the government strictly implemented a retirement policy for government doctors over 60 years of age, with the hope of reducing government expenditure by slashing jobs in the industry, how this has further increased the burden of carrying out operations as smoothly as possible on the remaining or limited workforce who would have naturally struggled to fill in the shoes that would have been left unattended. In conjunction to that, the country's pharmaceutical shortages in the last several months have left the country's health services paralyzed, to the point where people died as a result of not being able to access vital drugs and life-saving surgeries. Additionally, earlier this year it was reported that 80% of all pharmaceuticals had no reserves. The WHO also noted that 150 essential medications such as blood thinners, antibiotics, vaccines, and anesthesia and cancer chemotherapy drugs have already been run out to a certain point over the last year. These shortages have also set back waiting lists for surgeries, leaving thousands of patients to wait several months, if not years, to get necessary procedures done, risking further health complications which may result in death. Furthermore, numerous public hospitals have had or come close to suspending laboratory facilities due to delays in machine maintenance, lack of personnel, or having a limited supply of chemical reagents. This makes it evident that the health sector never anticipated such a blow and thus was never prepared for such a chaotic turn that was culminated in the various situations we have to endure. The lack of money allocated to the sector would also indicate the major reason for the instability within the sector. Under the Indian loan scheme, the government allocated the equivalent of $114 million to the State Pharmaceutical Corporation, but only $68.5 million were spent in the purchase of medicines, that too non-essential medicines. Meanwhile, as we try to juggle these different challenges we are facing, another Minister of Drug challenge after a spate of death, which occurred in the past few weeks, has raised eyebrows. Moreover, more patients have been hospitalized with severe allergic reactions as a result of being administered with a certain antibiotic which has now been recalled. The blame, which is being pinned on health workers who are directly linked to their individual cases for medicinal negligence, is being diverted to the health ministry itself for fairly obvious reasons. The cause of fatalities have not been traced back to the mishandling of drugs or medical negligence, but to the quality of drugs is what is in question. So, if one is to do the math, understandably the ward staff are not the ones in charge of importing medicinal drugs. Thus, the blame does not lie there, but also with those who do. But is the health ministry going to take any accountability for their poor procedures that don't test newly imported drugs properly, or the lack of preparation for this rainy day? Although there are contributing factors that can control this scenario out of their control, significant factors can be attributed to the negligence of the government for not having proper procedures in place to salvage a situation heading south. As a result, their mismanagement is essentially killing people who have otherwise had a chance at a longer, healthier life. So they're not robbing us of the opportunity to stay wealthy in terms of our bank accounts, but also taking away the metaphorical wealth in our state of complete physical, mental, and social well-being.